My question relates to tourism, even though, as you know, I, like many in the room, are not directly involved with tourism, but it impacts on us all. You mentioned COVID-contained countries that can come in without quarantine. So, and you mentioned New Zealand specifically. Are we considered? Have we categorised New Zealand as COVID-contained yet?
No, not yet. There's a few timelines they have to meet before our health officials can say that they're COVID-contained.
So that would infer it's quite close.
Yes.
Great. And will Fiji Airways sort of be timing themselves to recommence at the same time?
Well, you see, a lot of it depends on how New Zealand treats returning citizens of theirs.
Right.
You know, at the moment, I think there was some press statement that even Kiwis returning from certain places, if they travel outside, they have to go into quarantine. So if, for example, New Zealand says, yes, okay, you can go to Fiji for a holiday, they're COVID-contained, we are COVID-contained, but when you come back, you have to go into quarantine, and you have to pay for it. Then they say, well, hang on, let's not go to Fiji. Let's wait. A lot of it depends on the other party.
So they've just done that for cooks, right? They can return from the cooks without quarantine, I believe.
Well, there's different sort of pieces of information on that.
Right.
We got some news that they're going to do it for the cooks, but then I think the Prime Minister's put it on hold.
Ah. Yeah. So by inference then, other countries that we deem COVID-contained could be added on after New Zealand?
Yeah, absolutely. Absolutely.
Would you consider, because Australia's obviously divided, most of the states and territories are COVID-contained, or what I would consider COVID-contained with the two small Cs, whereas other two states, the bigger two most populous states, are not. Would you consider state by state, or would it only have to be a national, federal thing?
See, all of these decisions ultimately are made by the health people. And they, for example, Dr. James Fong is talking to the Assistant Medical Officer for the entire federal state, I think, and a couple of the other officials. We've got our health officials talking to Professor, I think, Baker from Otago University, who advises the New Zealand government, who's the advisor to the New Zealand government. So we let them clear those things first. It's not a political decision. But I think in respect of saying that certain states are actually COVID-contained, many people will argue against it because people say the borders are still porous. Although, you know, like Queensland has made a particular stance, having lived in Australia for 13 years, there's various ways of getting into Queensland, as you would know. In the same way with, you know, Victoria and New South Wales too. So I think, you know, that's why I think is what is delaying the trans-Tasman bubble. I think that's the issue. That's what perhaps is delaying it. So they, you know, they need to sort that protocol out. I think, because from what we have been told, the trans-Tasman bubble would mean that there would have absolutely no quarantine requirements between the two countries. So perhaps, you know, people aren't necessarily feeling secure at this point in time in those discussions, but I don't want to speculate. There are also other considerations. In New Zealand, we've got elections coming up in September. That may have an impact, depending on who's voting and who's not, and where the vote banks are. That's another issue. So you have to take all that into account. Sorry, there's one there.